If you or someone you love ends up in the hospital, there's a growing concern a critical part of their care will be missing: nurses. I'm Tisha Pell.
And I'm Lee Zurich. The federal government predicts by 2030, 42 out of 50 states will likely experience a lack of registered nurses, with states including Texas, Florida, and Nevada facing some of the biggest shortages.
Multiple studies show nurses are essential to patient care, and having fewer of them caring for patients is associated with more deaths.
We'll show you solutions from across the country combating the shortfall, but for one family, they say those potential fixes are too late.
The family of Michael Sharadin says the hospital where he sought emergency care was not properly staffed, and if it had been, he would be alive today.
To tell Michael's story, you'll hear some of his final words, and as a warning, we will discuss suicide.
If you or someone you know needs help, you can call or text 988 at any time. Now to investigative reporter Andy Parati.
Savannah, Georgia police respond to a call inside an emergency room in 2024.
So he was hanging, body, his body was like this.
Do you know who initially made that call to security?
Inside this bathroom, a man found hanging from his hospital gown. His name, Michael Sharadin.
I was with him. I was holding him. I had said to the doctor,
Carol is Michael's mom.
I said, "Doctor, how could this happen?" And he said to me, "I don't know." He says, "I don't know."
Before he arrived at Memorial Health University Medical Center, he called 911 from this hotel, begging for help.
Chatham 911, where's your emergency?
Hi, I'm having a nervous breakdown.
It happened when the 35-year-old New Yorker stopped in Savannah on his way to visit family in Florida. Diagnosed with bipolar disorder in his 20s, he recognized he was having a mental health crisis.
I'm having suicidal thoughts. I don't know what I'm doing. Please help me, please.
According to a pending lawsuit, when he arrived at the hospital, staff did not help Michael when he needed it the most, claiming they left him unsupervised when psychiatric patients are supposed to be monitored at all times. According to a police report, Michael was seen carrying multiple gowns into the ER bathroom, locking it from the inside. Security forced the break down to get inside.
I got there and I'm like, "How long's it been in there?" They said about 30 minutes. I'm like, "What?" I said, "Why are they just not calling us?"
Natalie Woodward is the family's attorney.
Did everything right. He did everything right. His mom did everything right. I mean, I think that's the tragedy of it.
The lawsuit claims when Michael went to the hospital, he should have been taken to a section of the ER reserved for psychiatric patients to wait for a mental health professional, but the ward was closed.
What was the reason for it being closed? You remember? Staffing.
And he was the only 13 that we had outside the department.
What does that mean to you?
To me, it means they didn't have enough nurses to operate that unit. This was something where it was just so preventable and easily preventable. This was literally just a matter of keeping eyes on him and making sure he doesn't hurt himself until the psychiatrist can get there to do what needed to be done next.
Memorial Hospital declined interview requests, but in a prepared statement wrote, "The loss of a loved one is devastating, and our thoughts remain with this patient's family and friends. We're aware of the filing, which we are reviewing, and we will respond through the legal process." While the hospital did not acknowledge if it experienced staffing issues the day Michael died, Georgia is among one of the top 10 states with the largest projected registered nurse shortages. According to the National Center for Health Workforce, these 10 states are on track to face shortages of RNs between 17 and 22% by 2037. The number of nurses that would be needed to fill the gap in these states, 194,000. Would you agree with that?
I would say that well-being challenges, resource challenges absolutely are still a concern.
Chelsea Agopian is Executive Director of the Georgia Nursing Workforce Center and an Assistant Clinical Professor at Emory School of Nursing. So, you may be surprised to hear She doesn't call Georgia's projected need for nurses a shortage.
So the problem with the rhetoric of the nursing shortage is it just ignores the complexities of nursing workforce challenges. So by just saying the nursing shortage, it doesn't give you enough information to define the problem correctly and then have good solutions.
Her organization, like many other state nursing workforce centers, is trying to figure out where Georgia's nurses are working or not working, to focus resources to medical fields where nurses are needed the most. At the moment, the state doesn't track that information.
If you ask, say, a private practice in Atlanta, they might say, we have plenty of nurses, where we're getting plenty of applications, where we have all of our patients covered, all the nursing services needs are met. But if you're asking, say, a rural community hospital, they may give you an entirely different story.
I could tell that he was pretty anxious.
I'm having a nervous breakdown. I'm having a nervous breakdown. I need psychiatric help, please.
A young man crying out for help in a hospital accused of not having enough staff to keep him safe.
And I think if somebody said to me, think of your worst nightmare, I don't think I could have imagined anything worse than that.
In June 2025, the hospital and health system responded to the allegations in court. They deny any negligence. Again, if you or someone you know is struggling with thoughts of suicide, help is available. Call or text 988 or go to 988lifeline.org.
Some in the healthcare industry have acknowledged the projected nursing shortage and are working on solutions. In the fall of 2025, the University of Northern Iowa welcomed its second ever class of nursing students. UNI says it created its first standalone Bachelor of Science in Nursing in direct response to the projected need in Iowa.
In Mobile, Alabama, a pilot program at USA Health University Hospital aims to help nurses reduce stress before it develops into a long-lasting burnout by providing special peer support and normalizing mental health discussions.